Today we're here at Cedars-Sinai to talk to world-renowned neurosurgeon Dr. Keith Black. What precisely is, glioblastoma? What kind of tumor is that?
So a glioblastoma multiforme is a tumor that arises within the brain itself. Glio stands for glue, so it arises from the cells that holds the brain cells together, or the glia. Blastoma just means tumor. The multiforme means that this is a tumor that can take different forms and different shapes and different characteristics, which is one of the reasons that it's so very difficult to treat. The symptoms of a glioblastoma can be anything that the brain controls, but most commonly this tumor affects individuals in the prime of their lives, usually presenting initially with the first seizure that someone may have as an adult. So seizures are very common. Headaches can be very common. Other things might be new onset of weakness or visual difficulty or speech difficulty. So those are very common ways that this tumor might actually present symptomatically for a patient. The earlier that one can detect it, the better one is able to treat it, because the tumor has not spread to other eloquent and critical areas of the brain that may make it more difficult to really get all of the tumor out that we see on the MRI scan, which is one of the important things that can affect prognosis. So it's not quite like some tumors. Some tumors, like breast cancer, if you detect it early, there's a possibility for a cure. With this type of tumor, even early detection cannot give us a cure, but it can certainly make the outcome and the prognosis better.
Is this curable at all?
The general view of a glioblastoma in the medical community is that this is currently not a curable tumor. Now, that is not to say that some patients cannot have a very long life expectancy with this tumor. Some patients may actually live long enough to die from other things. I've had patients with this tumor that have greatly exceeded what the data says is the sort of expected survival, and have gone on for 10 or 20 years and have died from something else with this tumor. But that is not the most common scenario for this. In general, you know, the standard treatment is the treatment that we've used for many decades: surgery, radiation therapy, and chemotherapy. We've made some progress in this tumor, but unfortunately the progress hasn't been as rapid and as great as we would like. I think there's a lot more progress to come. Surgery is limited, because even if we can get all of the tumor out that we see on the MRI scan, we still know that there are microscopic cells that remain within the brain that the MRI scan cannot detect. So there's still tumor left, and these tumors may be fairly dispersed throughout the brain. With this type of tumor, age is one of the strongest predictors of survival. So a patient that's less than 40 has a better prognosis with this type of tumor, same diagnosis, same tumor, than a patient that's 70 or 80.
President Carter's a survivor?
Right, different type of tumor, but a tumor that went to the brain itself.
Right, so how is it that people with these brain tumors are beating the odds like this? Because he's 93 years old, isn't he?
Right, so President Carter, according to what's been in the public domain, had a type of tumor called a melanoma that started outside of the brain and went to the brain. So these are tumors that spread to the brain. They're actually more common, metastatic tumors, tumors that come from outside of the brain that spread to the brain, about 10 times more common than GBM. President Carter, as I understand, had the benefit of having a new form of therapy that actually activates the immune system against melanomas that have had very good success in that particular type of tumor. So he has a particular type of tumor that, with the new advances really just within the last few years, have really shown great promise and great progress. He was able to take advantage of that. And so it's a different type of tumor that we've had much more success with. Senator Kennedy had the same type of tumor as Senator McCain, a glioblastoma multiforme. But according to my recollection, from the time of diagnosis until death for Senator Kennedy was about 15 months. And obviously he had access to sort of the best therapy available at the time. Now again, that was a number of years ago, and we have made some improvements, but it really just shows how devastating this tumor is and how complicated it is to treat.